Lepra and Mental Health Awareness Week, addressing the psychological impact of leprosy. This week is Mental Health Awareness Week, which is an opportunity for us all to come together to focus on getting good mental health. The week aims to tackle stigma and help people understand and prioritize their and others' mental health. For the charity Lepra, it is also an opportunity to spotlight the mental health impact of leprosy, a disease historically feared for its physical consequences. Though a cure for leprosy exists, people affected by leprosy face many challenges to their mental health and well-being. Statistics show that 1 in 2 people diagnosed with leprosy will face mental health challenges such as depression, anxiety, and a severe hit to their self-esteem. These issues are often exacerbated by disabilities caused by leprosy. Leprosy is a disease associated with discrimination and prejudice, and people affected by leprosy often find themselves alienated in society. And these are issues that Lepra works to address. Lepra supports people affected by leprosy and their mental health in communities across India and Bangladesh, where the disease is still very much present. During Mental Health Awareness Week, Lepra's efforts remind us that mental health considerations must be integrated into all aspects of healthcare and social support. By raising awareness about the mental health impacts of leprosy, Lepra not only advocates for those directly affected, but also educates the broader public on the importance of mental health support as a fundamental human right. We are joined today by Jimmy Innes, CEO of Lepra, and Maria del Mar Marais, Program Manager for Bangladesh, to find out more. And Jimmy, a question for you first, please. Leprosy continues to be a global challenge. How is Lepra working internationally to address this issue?
Great, thank you. And you're right, leprosy is still a global challenge. Oftentimes in this country, when we meet people and try and raise awareness about leprosy, we're met with a misunderstanding. Oh, leprosy, didn't realize it was still a thing, didn't realize it still existed. I thought it was a disease of the past. But it is still very much a disease of the present, and it does still very much exist. There's about 20 countries around the world which are called endemic countries for leprosy. 60% of all diagnosed cases happen in India. There's about 200,000 cases diagnosed every year around the world. And we know from our work on the ground and with our partners, we know that at least the same number again, another 200,000 go undiagnosed every year. And around the world, there's maybe 3 to 5 million people who live with the lifelong impacts of leprosy. So that's the first misunderstanding. People don't realize it's still a thing, but it is. The second thing which we often find with people is people that aren't aware, but leprosy is entirely curable. Since the late 1940s, drugs have existed to cure people of their infection, the physical infection. Since the 1980s, those drugs have been made freely available by the World Health Organization, the WHO, in what's called a multi-drug therapy, or MDT. It's a cocktail of 3 different drugs which you take for a period of time. And once you finish your dose, you are cured of your leprosy infection. You can no longer transmit it to anybody else. But leprosy is a very stubborn and difficult disease. It can incubate for years in the body before any signs or symptoms show, maybe 5, 10, 15, even 20 years. And when symptoms do first start to show, they're often minor. A numb patch on your arm, a tingling sensation in your fingers, a raised nerve in your neck. They're not things which really affect your life, but because leprosy affects the nervous system, the longer it goes undiagnosed and untreated, the more nerve damage you get, and that can manifest itself ultimately in physical impairments, especially in fingers and toes and hands and feet, the extremities of the body. So for us as Lepra, and for many people who work on leprosy, the trick is to diagnose as early as possible. We call it early case detection. The earlier you can recognize a case, the earlier you can get access to the cure, the more likely you are to reduce the physical and emotional mental health impacts of a diagnosis. So for us as Lepra, we work in India and Bangladesh, especially in rural areas and remote places. We've been around for many, many years. This year is our centenary year, so we are 100 years old in 2024. We've just received confirmation last week that King Charles III has accepted the royal patronage of Lepra taking on from his mother, the late Queen Elizabeth II, who was a lifelong and passionate advocate for our cause. And in a nutshell, what we do is we work for the better healthcare support for people affected by leprosy, better inclusion in society and rights for people affected by leprosy. And we also work on research innovation to help find new ways of better caring and treating and supporting people affected by leprosy. And leprosy is one of a number of what we call neglected tropical diseases, or NTDs. They're neglected because they're not funded, they're not prioritized, they're not politically important. And we also work in another NTD called lymphatic filariasis, which is also quite a common disease affecting people in rural areas of India and Bangladesh.
Thanks, Jimmy. Now, Maria, this week is Mental Health Awareness Week. Why is that important for the work of Lepra?
Yeah, thank you for the question. So Jimmy has mentioned the physical aspect of leprosy, this bacteria that attacks the nervous system. But we have realized that leprosy has an impact not only on the physical health of people affected, but also on their mental health. So we know that 1 in 2 people that have a diagnosis of leprosy or LF suffer from depression or anxiety, and this is due to a number of factors. First of all, the social stigma that's attached to the disease. So people affected by leprosy may face isolation, rejection, or exclusion from their communities due to all the fear and misconceptions around the disease. And this social stigma can lead people to have feelings of shame, low self-esteem, and depression. Also, having to live with the physical effects of leprosy, especially if you have a late diagnosis, people may have to live with impairments, chronic pain, physical disfigurements caused by the disease, which can affect their ability to work, to participate in daily activities, to participate in social activities, all of which leads to feelings of frustration, helplessness, and also depression. And the last factor is the unavailability of mental health support in the countries that we work in. So, for example, Bangladesh, which is my focus country, it's a highly densely populated country with 168 million inhabitants. And there are only 260 psychiatrists in the entire country. If we compare this to UK figures, in a country of 68 million here in the UK, we have over 13,000 psychiatrists. So we think, given this lack of available services and also the high prevalence of mental health illnesses with our population of concern, that mental health has to be one of our key intervention areas.
Now, what does Lepra do to support mental health for people affected by leprosy in Bangladesh?
In Bangladesh and India, it's because these countries have a severe lack of mental health services available. So, for example, mental health, in Bangladesh, which is my focus country as a project manager, there's 168 million inhabitants. It's a highly densely populated emergent country, but it only has 260 psychiatrists to serve the entire population. If we compare this to UK figures, in the UK with 68 million inhabitants, we have over 13,000 psychiatrists. So given the high prevalence of mental health among people affected by leprosy and LF and the lack of available services, we feel that Lepra should be focusing on mental health and have it as one of our key interventions.
And how does Lepra adapt its approach to mental health support specifically to address the needs of women affected by leprosy and LF?
Yeah, thank you. And, for leprosy is possibly the most prejudice against disease in the history of humanity. Everybody who hears the word leprosy has a connotation with it and with the disease, and more often than not, that connotation is negative. It's about ostracization, being outcast, being discriminated against. And unfortunately, in the places where we work, that burden is borne more by women than men. In my job as the CEO of Lepra, I'm privileged to be able to go to different places to visit India and Bangladesh and see the work that we do firsthand. And I've met with hundreds of people affected by leprosy, all of whom have a fascinating story to tell. Many people have wonderful stories of inspiration and and how they've overcome barriers in their life. But other stories really are poignant and very touching and can leave a big impression on me. And more often than not, those stories come from women. I've met women who have been thrown out by their husbands, who are experiencing marriage breakdown and difficulties, who've been thrown out of their homes, of their neighborhoods, of their communities, and been ostracized in their society because of their leprosy diagnosis. Last year, I was in a village in central India, a very rural place. We visited a house where the father lived. He was alone. His wife had died. He lived with his children, 4, 5, 6 children. He himself, the father, had been diagnosed with leprosy about 10 years before and been cured. But now 3 of his children had been diagnosed with leprosy. So we visited there with the local health professionals. And one of his children who's been diagnosed positive was a young woman of about 18, 19 years old. And she had a young infant in her arms, maybe 2 months old. And she was, since she'd been diagnosed a couple of weeks before, her husband had already thrown her out and left her, assuming she must be cursed to get infected with leprosy. And he'd returned her back to her father's house. And that young woman, I was there just thinking it, trying to understand it from her perspective. She's here as an 18, 19-year-old being a mother for the first time at a young age, trying to come to terms with the positive diagnosis of leprosy and the impact it's going to have on the rest of her life, and now being thrown out by her husband. It really left an impression on me about how much she and other women have to deal with a positive diagnosis of leprosy.
Yeah, and at Lepra we try and prioritize the needs of women because, as Jimmy says, a diagnosis of leprosy can have a huge impact on women's life, all aspects of life. So I mentioned earlier that the unavailability of mental health services. So one of the creative ways that we at Lepra try to breach this gap is by training peer supporters or peer counsellors to be able to actively listen to people's feelings of isolation, of rejection. And in the case of Bangladesh, we make sure that these peer counsellors, or what they're called as mental motivators in our district of Bogura, which is a northern district of Bangladesh, are female. So that means that women affected by leprosy can have a peer female supporter who they can interact with and build a relationship with and feel comfortable in sharing their feelings, which hopefully will contribute to improving their mental well-being. We also try to build the capacity of women through strengthening people's organizations, by training women on public speaking, on advocacy, and on leadership, so that the leprosy world has strong female leaders who are able to advocate and demand the social entitlements and disability benefits that they are entitled to.
And where can listeners go to find out more?
Thank you. The best place is to go to our website. So our organisation is Lepra, that's Lepra, and the website is www.lepra.org.uk. That's lepra.org.uk.
Jimmy Innes, CEO of Lepra, and Maria del Mar Marais, Programme Manager for Bangladesh, thank you so much for joining us today.